Cam, my 6-month-old baby brother, will represent me as a brand new nursing student. The world is at my fingertips. There are so many opportunities waiting, and I am so eager to learn. I soak up everything like a sponge, and I am learning faster than I ever thought possible. I lack the effective verbal communication skills needed to convey the messages I'm trying to portray. Like Cam, I depend on others, such as my instructors, to teach me how to effectively and therapeutically communicate. Also similar to Cam, as a student nurse, I depended on others to help me and to teach me all the skills needed to become the professional nurse that I plan to be. I have built trusting relationships with others and relied on them to provide me with everything I will need to become a proficient nurse, much like he relies on parents and family to teach him everything he will need to become a proficient child and eventually a successful adult. Peyton, my 11-year-old little sister, represents me as a level 2 student. She is in 6th grade, the bridge between baby elementary school and big world high school. Similar to her, my foundation has been established and now is the time to build. I now have people who look up to me and people asking me for advice on how to be a better student. I have learned the fundamentals of nursing and I have a basic knowledge base to build on. At this point, I have reflected on myself and I have developed my own personal values and standards. I am working on mastering the concepts of communication and time management, yet I think I already have a pretty good grasp on it. I am just getting the hang of being a good student and I feel like I am catching on to this test-taking thing. I am establishing more and more independence, yet I still have the security to run back to mom or my instructors when I am unsure of myself or if something is to go wrong. I have the security of knowing that mom, my instructors, are right outside the door or right around the corner if I shall need them. LJ, my 16-year-old little brother, will represent me now as a student but almost a graduate. I have grown up now and I am ready to use the knowledge instilled in me to become the best professional I can be. I have been taught well and I think I have all the knowledge that I will need. I am ready to conquer the world without mom and dad and my teachers, and I am dying to spread my wings and fly. I cannot wait to graduate, and I am counting down the days until I get that piece of paper that says I am free. We have 7 days now. I know that life after school will be tough, but I have a great outlook, and I know I am prepared for anything, or at least I think I am. I have been here before, in this hospital, and I've taken care of these patients before. I am prepared for this. And a few months later, reality sets in. I am the new graduate, out here on my own, without my teachers, and I suddenly have to do all this real nurse stuff all by myself. I'm sure there will be a time very early in my career when I feel like I am being pulled in 20 different directions. All 5 of my patients' call lights are on. There's a doctor on the phone returning my call, and ER is waiting to give me a report on my new patient. Plus, all of my 9 o'clock meds are due, and none of them have been given. I suppose I will go through a bit of reality shock, just like LJ will when he goes off to college without mom and dad anymore. I will need to stop and think about the things they taught me back at home. Skills like priority setting, time management, organization, and communication will all need to be recalled. I will have to take confidence in everything I have learned and remember to trust the things my parents, my teachers, have taught me. My parents, my mom and stepdad, represent the proficient nurse I aspire to become. They work well with each other to accomplish a central goal and care for others. They communicate well with each other as a team, and they are amazing advocates for their children, much like I plan to be for my patients. They are well established in their roles, they are extremely efficient, and changes in the normal routine do not throw them off easily. They are selfless and put their children before themselves, much like I will put my patients' needs before my own. They take on many responsibilities, many of which are not necessarily asked of them. They are able to juggle countless tasks while remaining patient and pleasant in the process. They know which tasks to delegate and which ones require their own assessment and intervention. They are able to balance work with personal life, and they understand when it is time to take a break from both. My stepdad holds a position on the board of his local chapter of the United Steelworkers Union, an organization that advocates for better jobs, increased wages, and safer work environments for its members. I plan to become a member of a national nursing association, perhaps the ANA, or possibly a specialty organization. Who knows, maybe I'll even be a member on the board one day.